I've been doing the hepatitis C clinic here for the last 23 years. We started it from scratch, and it's been quite the ride. Our focus switched very much from how can we support other providers to how do we even find people to engage with them who don't even have providers necessarily. So that's where the model of use of having the outreach pharmacist and the peer support worker really came into play, and it's just been so exciting.
So for us, Seek and Treat has looked like partnering with organizations like shelters, with addictions clinics, drug court people, with people in the hospital, like addictions teams in the hospital. Really just we've kind of thrown things at the wall and seen what stick.
I think that was about 14 years ago, because I wound up with a stay in the hospital. When I got out, they suggested I go to CUPS. And then I met Dr. McPhail. I called her the liver lady. I had a blood test and it confirmed that I had hepatitis C.
And so being able to see people where they're at to say, let's talk about the hep C that you've known you've had. Like Patrick knew he had it for years and hadn't accessed treatment, hadn't heard that the new treatments were available. If we hadn't gone into the permanent supported housing, we wouldn't necessarily have found them.
My role is kind of interesting or unique in that I hold two positions. One where I'm working here in the clinic with CUPS, and then another where I'm actually working on site in the shelter as more of like a community pharmacist. The drop-in center is a very, very large shelter in downtown Calgary. Basically have tons of services there. They have lots of housing and social workers. What's interesting though is over the pandemic, they've seen obviously healthcare services ramp up a lot, which I think has been key for things like addiction care, but also hepatitis C care.
The health workers are usually here, bang, boom, slap, and away you go. But Nicola, yeah, just different, more of a people person, and just more herself, relaxed, and you know, it makes it easy to talk to.
Being a client myself at one time, you know, I used to also be someone that accessed services at CUPS, and now I work there, you know, so for me, I think when it comes to that in my role, one of the things is I'm no less, I'm no better, I'm just as equal as anybody else, and I also know what it's like to be that client. Sure. Come get checked out, you could just have a little finger poke too, right? Safe than sorry. Especially within the Hep C program, if they know that I've been through the program and been through treatment, you know, and did the medication, you know, you build rapport, and it also builds the connection. And one of the things, like with addiction, the opposite of addiction is connection.
I love working with Nicole. She is like fantastic. I've learned so much from her. So Nicole has been super integral to the Seek and Treat model as well. Clients love Nicole. Like, she's just so personable, and yeah, she makes Hep C care accessible to people, and that's really what we want.
With Arch, we realize we can't have patients for forever. But even if we have a few days and we have consent and a diagnosis, we can do blood work, we can get the initial steps started and connect these patients to CUPS and to the community with a plan in place.
I started using crack first, and then OxyContin, and then OxyContin went into morphine morphine went into heroin, heroin led to fentanyl, and fentanyl led to me dying and then being out for about, or dead at least for about 20 minutes. The trauma my brain had undergone from the lack of oxygen caused my ocular cortex to receive significant enough trauma for my sight to have been lost.
The ARCH program has allowed us to connect with people like Aaron, who was admitted for a medical complication related to substance use.
See, when I first learned I had hepatitis C was when I was stabbed last year in February. It wasn't a priority, but it was also not I couldn't do it financially. So hepatitis C became was put on the back burner because of its, I found it was harder for me to get the help I needed versus harder for me to get the drugs I needed.
We kind of continued to carry on what the ARCH team started, and were able to start his medication while he was in the rehab.
After I was approved through CUPS to get the financial support to help pay for the medication that I was on, Nicola Gale, she was the person to coordinate my treatment when I came here.
It was back in 2007, I went to CUPS, so they were caring, even right from the beginning. And that meant a lot to me, right? Dr. McPhail was the first doctor that I was introduced to as far as trying to look at a treatment plan for Hep C back then, right? So even all these years, we've stayed in contact. She's always managed to somehow track me down and get a hold of me, right? And that's what kept me coming in, right? Because I would have never done it on my own. Being treated and then having the treatment come out 100% on my side was the first step into a new life.
I think for me with Hep C care, for a lot of people it isn't at the top of their list, like it's not the #1 priority, but it's on the list, and it's something that we can achieve in a relatively short time frame. And I think some people just really need a win, and it's a great gateway to other care and services.